So we're gonna go over a rolling side bridge. I use this a lot in my office for people that have a lot of low back pain, a lot of hip pain, and I feel like it's really great for people who may be doing like a regular side plank or some other variation just isn't hard enough. They're pretty well trained. This is a challenging one. A lot of people seem to benefit a lot from it. I want to share it with you, so let's go through it. All right, so we're gonna lay on our side and we're gonna kind of open up our hips. So I've kind of got about a 90-degree amount of flexion here in my hip, and my feet are kind of spread out like so. Palm down, elbows in contact with the ground. I'm gonna lift my ribs up so that I'm a nice straight line. And the goal here is, if I imagine all four kind of ball and socket joints are like a rectangle, I'm not gonna start doing any twisty stuff. I'm gonna move everything kind of as one. So I'm gonna start shifting my weight onto this hip here on the bottom. This leg is gonna be up in the air. I'm gonna roll forward, and as I roll, my ankle's off the ground, I'm making contact with my knee. I'm just gonna kind of lift my chest up, and I'm gonna shift my weight onto that hip. And so now we're kind of in this side bridge position. I'm really gonna slow this guy down and control it on the way back. Remember, I'm not doing any weird twisty stuff. I'm also not kind of like throwing my weight up and using that momentum. Nice and slow and controlled. So I'm shifting my weight forward, I'm closing this hip here, and I'm kind of rotating up. I kind of like to imagine I'm like hugging a barrel. So I'm kind of going back and forth here, really getting into that hip on that bottom side, keeping my spine nice and neutral. And this is the rolling side bridge. Play around with it and make sure that you're really doing a good job controlling it on the way down, nice and slow, and hopefully it helps you out a little bit.